Hello, friends and patients. Glad to see you back. This is the third installment. Is what in the world is Dr. Spann doing on Tanna Island? You've learned a little bit about where Tanna is and what the people are like, and that it's different, and a little bit about Cyclone Pam in 2015. Now I'd like to take a few minutes and share with you the missions history of how Baptist missionaries wound up on Tanna Island in 2019. So in 1858, John Patton set sail into Port Resolution, Tanna Island, approximately 10 years after, or 20 years after the martyrdom of John Williams and some of his compatriots, as well as the Robertsons, which you'll see photographs of in just a minute. And he set up a mission station just beyond the shoreline that you see beneath Mount Yasser. John Patton sits in the midst, the man with the long white beard. He had come from Aniwa back to Tanna Island for this picture, and this was taken in the southern part of Tanna Island, either near Quimera or Port Resolution. To his left, you see William Watt, the man with the long dark beard at the lower left of John Patton, and his wife, Agnes Watt. Now, at the time, Margaret Whitecross Patton, John Patton's wife, his first wife had died on Tanna Island years before, is the gray-haired lady who sits just to Mr. John Patton's left. And she has written a book with sketches about Tanna Island, of some of which drawings we actually will make reference to later in this series. These missionaries had an annual calendar of photographs that were sent out to their home mission supporters. This was sent out in 1883. And this shows the Reverend Watt at the top left of your screen. And then downward you see the Goodwills. This was a man who was on Santo with his wife, Espiritu Santo. And then on downward, and you see missionaries that I've encircled, such as William Gunn, who was a medical doctor on the island of Futuna, southeast of Tanna. You see the Reverend William Gray, who was just a mile and a half south of where Carrie and I work, in Lonangi Village, at a village there called Waisisi. And you'll see their photograph with their baby in just a few moments. You see the Robertsons, who were martyred in 1873 on Erromango, very much like John Williams and his mission helper were martyred in 25 years earlier. You see that this was a synod, or a gathering of the Presbyterian Missionary Society, as well as some of the missionaries from the London Missionary Society. And you see William Watt there at the bottom center, and his wife Agnes. Many of their children and grandchildren are surrounding them, as well as many of the other missionaries from the New Hebrides, from islands like Epi and Naguna, Pentecost, Espiritu Santo, Efate, Futuna, Aniwa, Anicham, and many of the other smaller islands in the northern parts that I've never seen. But they would come and they would have a synod every year on one of the islands. This is William Watt and Miss Agnes, who worked there for over 25 years. When they were in their latter years, they had had many converts to the work, and these were some of those converts. You see Miss Watt's grave that sits in Port Resolution, and her footstone that I found one day in 2010 walking through down one of the trails in Port Resolution. This is what a man on Tanna would have looked like about the time this mission work was taking place. They would have up to 700 braids in their hair, and most were bearded, and they were quite fierce looking. And they would have been even more fierce looking at this cannibal feast, where you see one of the men laid on the ground and another who's suspended from a pole. This is a famous painting that's shown in the archives of the nation of Vanuatu. This is Waisisi Village, and this was William Gray and his wife and their small baby that you see in the bonnet. And obviously she's moved just a little bit and leaned forward in the picture. There were other babies born on Tanna, to the Michelsons, for example. And these children grew up, and they're pictures of these teenage girls before they married and went into mission work in the New Hebrides with their husbands. This was a physician, Dr. Nicholson, and his wife, who worked in Lanacle, which is the area that the wharf and the port are in, and where many of our close friends and family members, we consider them, live today, such as our long-term nurse Ruth Nalpini. You see here Frank Patton, which was John Patton's son, who continued the work in Lanacle, and a Mr. Hume, the man in the center, both with white clothing on. And Mr. Hume was named for one of the children of John Patton. You see a missionary excursion out toward the volcano, which looks very much today like it did then. You can see at the very far right of the volcano a straight sloping line, and that line is not much changed 140 years later. You see a small boat that goes from the shoreline there out into Port Resolution to carry supplies back and forth. And the photograph that you see here I took in 2018 from the very same spot. You see how the lawn was laid out and the reed fence that was made to keep livestock or pets in. And you see the tug of war that was had during mission dinners on the grounds. And across the bay there would be sulfur springs that you'll see in just a moment. That ground is not much different today than it was then, and the natives still kept it mowed with machetes just like they did at that time. You see this sulfur spring where they would actually cook their cannibal victims. In one story, a small mission boy that helped with the mission work in Port Resolution came back with a tea kettle from the hot boiling sulfur spring and told John Patton, "Missy, we cannot have tea today because there's blood in the water." This was the plane that we descended in 1998, and that plane landed there. This is a very similar plane several years later. That plane landed on the White Grass, Natural Grass Airport. It was quite a steep descent, and we could actually see very well under the door of this old-style airplane. And we landed and saw what I have affectionately called the uppermost of the innermost of the uttermost parts of the world. We camped out and had a medical mission effort from this army tent. It was unbearably hot and humid, but we spent 7 effective days there with taking care of babies from all over the island, some who were so sick that their eyes were bleeding, and seeing things that probably couldn't even be well taken care of in MD Anderson in the United States. It's very difficult to see people who have illnesses that are beyond the care of even modern medicine, much less the small amount of supplies that I could take in. Especially harder when children are born with birth defects or cancers, and their parents are not able to ship them in, and we're not able to have the kind of sterile operating conditions and anesthesia that would allow them to have an effective surgery to keep their tumors and things that might end their life early or make their life very unhealthy and painful. We do the best that we can, and we pray a lot. My work really started this day 1,200 feet below the main village when I took this 3-wheeler down with the missionary. Found a small baby that had been brought to the beach because the baby they felt was dying with pneumonia and a high fever. I found that he did have pneumonia, but in 3 days with just routine American medical care and Western medicine, this child was running around the village, and they still think he's magic today and ask him to put his hands on them when they're sick. He's a strapping 21-year-old young man now, and he and my son Samuel are blood brothers. And we'll pick up with our mission history on Tanna in our next brief installment. Thank you for your attention, and we look forward to seeing you in our next video.